My name is Dr. Barbara Melosky. I'm a medical oncologist at the Vancouver Cancer Agency, British Columbia Cancer Agency in Vancouver. The result of LUX-Lung 7 showing an improvement in progression-free survival, which is statistically significant for afatinib versus gefitinib, I think was almost expected. We know that the second generation are pan-HER inhibitors, are irreversible inhibitors at the ATP domain. So there's reasons why it should have been better, and I think that it panned out. I think that the hazard ratio of 0.73, which was significantly significant, shows it to be the superior TKI. I think it's a really interesting curve. The progression-free survival almost separate at the median. And I think it could probably be explained by the resistant mutations that exist that we know about. So afatinib does have some T790 inhibition, and you can think that perhaps both drugs are working equally, but then as one acquires a resistant mutation like T790, then the afatinib shows itself to be superior. So I think it probably makes sense that they separate around that period of time. Well, the major strength, again, of LUX-Lung 7 is that it's a direct comparison. Patients are stratified per the type of mutation. It's done in equal population, and it is a positive trial. The main take-home lesson, or the main take-home message, is that afatinib is the superior TKI if one wants to achieve an increase in progression-free survival and hopefully overall survival and maintain quality of life. Yes and no. I think I've been using the 19 deletion as a reason to use patients on afatinib, and the 21 mutation has always been a question since we saw the results of LUX-Lung 3 and 6, where chemotherapy really was equal in the overall survival. It wasn't statistically different. And I think LUX-Lung 7 showing that afatinib is better than in that 21-point mutation, I think that's really interesting. That's the harder mutation, and it always been my theory that that's where a superior drug is needed, or for the harder mutation, and I think it shows that with the response rates.